Hello, and thanks for joining us. This is John Stanford, your regular host of the Making Medicine podcast. But today is MIT Takeover Day on the podcast with two distinguished alumni joining us, including our first ever guest host. It's my pleasure to welcome Lindsay Androsky, who will be hosting today's episode. She's president and CEO of Roivant Social Ventures and Incubate's board president. Lindsay, before you take over, we always ask people about their path to where they are today. And before you welcome Daniel and host today's episode, can you talk a little bit about your experience, what you're doing at Roivant Social Ventures, and if you don't mind, why you added Incubate to your many activities?
Yes.
Lindsay, so thrilled you're doing this. I'll turn it over to you for today's podcast.
Thanks, John. I'm very happy to be here today. First, my path to Roivant was a little bit unusual. As you mentioned, I'm an MIT grad. I studied biology there, originally thinking I would go for an MD, PhD, and help research cures to diseases. I spent a little time in the lab as an undergrad. We are fortunate to have many opportunities to do that at MIT. And I very quickly learned that I have the wrong personality for a life in the lab. So I took what I thought was a very sharp turn in another direction. I did strategy consulting, a very common path for a lot of MIT grads. I got a JD and an MBA from the University of Chicago. And then I became a trial lawyer for a decade and a federal prosecutor. I focused on national security cases and cybercrime, and did a variety of trials at the state and federal levels, as well as appeals in the appellate courts. Then I got a call from one of my friends at MIT who asked me to come and join a really exciting early venture called Roivant Sciences and be part of the founding team. And specifically, he needed someone to build and lead the deal team there as they were busy doing in-licensings and acquisitions to found new startups around. That was an opportunity I couldn't pass up. It was a really fascinating way to take my initial love of biology and the desire to help patients and apply a very, very different skill set to it. So I had many exciting years at Roivant Sciences, and then last year decided to leave my deal team duties, promote my number two over there, and look for something else to do. And the something else was launching and running Roivant Social Ventures, which takes a lot of our expertise and learnings from Roivant Sciences and applies it to the early stage ecosystem, and specifically a place where there's unmet patient need or other reasons why programs are not yet ready for commercial stage or venture capital investment. And so Incubate is actually, so my interest in this is perfectly aligned with what Incubate focuses on, because in my admittedly biased view now, much of the most exciting things that happen in the biotech industry happen at this early stage. Over the course of time in my role at Roivant Sciences, I got to know many of the academic and research institutions and saw so much exciting science being developed with a lot of promise for patients, and recognizing that a lot of that was never going to make it to patients because there's this critical stage in between invention and commercialization that often requires venture capitalists or others who are willing to take a risk on exciting, speculative, potentially promising medicines and help get it to the next level. And so that's what we do at Roivant Social Ventures, and that's what I want to help bring people's attention to through Incubate. So our guest today, I'll turn it over to him, is Daniel Carballo, who is a fellow MIT alum and who is the founder and CEO of Encora Therapeutics, has promising technology focused on an area where there is still a lot of unmet need for patients, and specifically Parkinson's. So Daniel, thank you for joining me today. Can you start by telling us a little bit about how Encora came to be, and specifically while you were still at MIT?
Yeah, thank you so much, Lindsay and John, for having me. It's a real honor to be here. To answer your question, Encora Therapeutics was actually born out of our mechanical engineering senior capstone class project at MIT. And so this is a big product design class, which every mechanical engineering student looks forward to taking from the minute they decide their major. And the entire senior class takes it at the same time and is broken down into these massive teams of 20 students. And each team has the task of coming up with a product idea, developing an alpha prototype, and then presenting that alpha prototype to a really massive audience. The first couple weeks of the class prioritize brainstorming, really just looking at trying to produce a quantity of ideas over striving for a quality. And the motivation behind that is to really stir up creative things that are non-obvious. And so the idea of making a wearable device to help tremor patients started out as one of these pie in the sky ideas. And to hit a quantity quota, if we hadn't been tasked with thinking so creatively, this is not something that we would have come up with.
What sort of guidance was your team given in this brainstorming exercise? Did you start with Parkinson's? Was it broader than that?
Yeah, so the entire class, each year there's a different theme, and our year the theme was super. And our team had a sub-theme of things having to do with the hand. And so we interpreted that combination of things as, rather than giving someone supernatural abilities with their hand, as just restoring normal function to someone with impaired fine motor control, such as a tremor patient.
And so, what were some of the other finalists? I mean, was everyone on board with the Parkinson's product, or was it a tight race?
Yeah, so that's actually the answer to that question is actually pretty funny. So the runner-up to the tremor reduction device was ergonomic handcuffs, and while the tremor reduction device was originally my idea, I was so skeptical that we could get something to work, that I was actually in favor of the handcuffs originally. But thankfully, I was outvoted by the rest of my teammates, who in spite of the anticipated difficulty that we would have making something of actual value, were just really driven by the potential impact, even though we had no real hope of it actually working. But thank God we did, because otherwise we wouldn't be where we are now.
Tell me where your skepticism came from. Why was your initial attitude that this was something that was going to be very difficult to accomplish?
So I guess I figured that we didn't really have a good plan of what that would really look like, of what it would take to make a device that would help a tremor patient, and none of us on the team had a strong neuroscience background to support this development work. So it really was originally a very crazy idea. And beyond that obvious, and this was a mechanical engineering class, not a neuroscience or biomedical engineering class. I also fully anticipated that everything would take twice as long and be twice as technically challenging as we would have anticipated. And that, while it wasn't true originally, that's been something that's been true since.
Well, we'll get to that part. So you're outvoted. Your teammates say no to the ergonomic handcuffs. Instead, we're going to focus on Parkinson's patient. What happens next? How do you guys go from this idea to an actual product?
Yeah, so then we spent the rest of the semester tinkering with some very rudimentary prototypes, and we had encountered some literature, some previous work showing that there was potentially a benefit using vibration at the wrist to improve motor control, in particular in tremor patients. but that the results to date had been highly inconsistent. So part of the key part of our innovation was embedding sensors into the device, which allow us to characterize the patient's tremor and customize a vibratory stimulation for that patient. So it took us a long time through the class to get something that actually worked, and it wasn't until the week before final presentations that we finally had a good enough prototype that we went and tested with a patient with early onset Parkinson's disease. Who had a debilitating tremor, and we tested with him, and just magically his tremor went away like that, and his family was there, and they teared up, and we all teared up because it was so shocking to us that could actually happen, and it was so visually striking to see the effect that it had on this gentleman, and everything really changed for us in that moment.
What were the most difficult challenges your team experienced during the time period when you were trying to get to a prototype that you could present in class?
So we, our device was fairly sophisticated from an electromechanical perspective, and we were trying to fit a lot of electronics into a small and flexible wristband form factor, and so that took a lot of iteration, and the first couple prototypes were frankly pretty ugly before we got to something that actually looked presentable, that we made a nice leather band and a polished aluminum housing for some of the core electronics. But it took a lot of iteration, and we weren't really getting a lot of positive feedback from our original development because we hadn't been able to get somewhere that we could actually test with a patient yet.
And how were you able to connect with a patient as you were preparing for the final presentation?
Yeah, so I think we just through word of mouth, we were able to connect with some local support groups, and were able to find a small number of local folks that were interested in giving our early prototype a chance.
And when you say local support groups, you mean Parkinson's patient groups? Someone reached out to them?
Correct.
Okay. How much support did you get from MIT, either inside the class or outside the class, during this project?
Yeah, so during the project, we got a lot of support from the instructors of the class to help with iterate on our design and think through, but primarily engineering questions, because it was an engineering class. And it wasn't until later on that, once we had successfully tested, that we started to seek out more entrepreneurship educational resources, which we were luckily able to find in abundance within the MIT ecosystem.
So coming to the actual, the big day, final class presentations, I know you mentioned how exciting it was, but walk the audience through what was that day like in more detail.
Yeah, so while we had tested successfully with this one patient before, there was still a lot of, we didn't know how repeatable those results would be. We hadn't spent a lot of time making sure that the hardware was going to be robust. And while we thought there was certainly a chance that it would still work when we did an on-stage a live demonstration, we certainly didn't take that for granted. And so I was actually backstage while we were doing the live demo, and was sitting back there holding my breath and terrified that it wouldn't work. And when it did, it was just such a huge relief. Yeah.
So what was the demo itself? What did the patient do?
Yeah. So the demo, in the demo, we asked the patient to with a marker trace a spiral on a piece of paper. And so this is one of a series of tests in the conventional test battery for evaluating tremor severity. And so this was, we decided to implement that test, and it's a very visually striking test, and our patient's performance on the test on stage was similarly striking.
So success on stage at the end of the class, what happens next? How do you go from, wow, we really achieved our ambitious goal in class, to we're going to turn this into a company?
Yeah, so it took us a decent amount of time to really come to that conclusion. It took us a while to one, figure out what we wanted for ourselves and our lives and our careers. Took us a while to figure out up from down in the world of entrepreneurship, because that was not something that we had been aspiring to pursue before this moment. And a lot of our team already had made post-graduation plans, already had job offers that they had accepted. And so, but now had to question that, hey, maybe there's an opportunity to do something really meaningful with our time, with our talents. Having been equipped by MIT with these skills, what is really the highest and best use of our time and our energy? Is it management consulting? Is it postgraduate studies? Is it working in big tech? And the entire team didn't end up making the same decision of the original 17 classmates in the project. Only 4 of us decided to continue to launch the company. But for those of us that have continued, that now make up Encora Therapeutics, we all once we started to see the path forward for really generating impact and like you mentioned earlier, traversing the space between invention and commercialization, we really can't imagine doing anything else.
So of the 4 co-founders of Encora, what opportunities did you guys decide to walk away from in order to devote your time to this?
Yeah, so one of us had actually already started a engineering job that he really loved, and another had offers from McKinsey and Harvard Business School, and 2 of us kind of spent we still did our master's degrees and spent that time figuring out what needed to be done to actually launch the company, to raise capital, and incubating the idea while doing our graduate studies.
So after you decide to start Encora, and you're going full-fledged into it, what resources at MIT were you able to pull on to help you learn what it is to be an entrepreneur, make the right contacts, etc.?
Yeah, so we were very fortunate that MIT is a very active and rich entrepreneurship ecosystem, and without that, I really don't think Encora would have really made it off the ground. So between both the business school Sloan and the School of Engineering, each have their own, I guess, programs for facilitating entrepreneurship and educating both engineering students and business students to learn what it takes to start a company, and equipping them with the networks in the broader Boston ecosystem, and the frameworks to launch a company the intelligent way, at least more intelligently than doing it blind.
So here's the good time for me to put in a little plug for what we do at Roivant Social Ventures, because someone who is not an MIT alum, but who was aware of our goals and our social goals and our resources at Roivant Social Ventures, and also knew you at Encora, made the connection between us because we are both MIT alums, thinking that this would be a good fit. And we both agreed that it was. And so I'm very excited that Encora Therapeutics is one of the first companies that Roivant Social Ventures is actively helping incubate. And one of the great things about this entity that we have set up as Roivant Social Ventures is that I have the ability to pull on the expertise of everyone across the Roivant family of companies to donate time and energy pro bono to the companies that we are helping to incubate. And so I'm going to say that last part again because I heard someone else's voice. One of the great privileges of Roivant Social Ventures is that I have the ability to pull upon all of the expertise and resources across the Roivant family of companies. Everyone who works for the Roivant family of companies is able to donate time and energy pro bono to help us incubate these promising companies that are very early and are addressing patient unmet need. And it's been a privilege to work with Daniel and see their progress thus far. So talk to me, Daniel, about you've reached some exciting milestones with FDA and with CMS. Can you talk a little bit about that and how you were able to navigate that part of your journey?
Yeah, so one of our earliest big questions was whether or not we would have to sell our device as an FDA-regulated medical device. But we quickly learned that if we wanted to say anything interesting in our labeling, that we would need to go through the FDA. Unfortunately, there weren't many MedTech companies or entrepreneurs close to the MIT ecosystem at the time we were there, which made it difficult for us to build conviction around our regulatory and go-to-market strategies. Ultimately, we managed to find some really awesome regulatory consultants who have been tremendously helpful in developing our regulatory strategy, preparing regulatory submissions, and even joining our first Q-Sub meeting. In particular, they were very helpful in working with us to apply for the FDA's breakthrough device designation, which we were able to receive on the support of some of our preliminary data that we had collected. And so what the breakthrough program gives us is access to extra channels for communication with the FDA, as well as expedited review for our submissions. There's still a kind of a question mark around whether or not, so there's a program called the MSIT program, which has been kind of going back and forth CMS has been going back and forth whether or not this is something that is going to actually wind up being implemented. But the idea is that any device that receives breakthrough designation will receive 4 years worth of coverage from CMS upon regulatory clearance. And so we've got our fingers crossed that the MSIT program does end up coming to fruition, and that we're able to get some early coverage through that program without having to separately conduct additional trials to support coverage decisions.
So how big is your team now? How large of a team did it take to reach these preliminary accomplishments?
Yeah, so right now our core team is 4 engineers, but we've been very active in seeking out mentors and advisors and consultants that can help us fill in the knowledge gaps and the background and lend us the expertise and the scar tissue that it takes to successfully and prudently navigate the medtech space.
And so you are still just the team of 4 from your class in undergrad.
Yeah.
That's very exciting. What's next for you? Where is Encora headed?
Yeah, so right now we're working on spinning up our first pilot trial, working with investigators at the Massachusetts General Hospital here in Boston, and that will be really critical for us showing in a third party and clinically rigorous setting that our device has at least some preliminary safety and effectiveness. And that will be really, that's our key value inflection point upon which we'll be able to go out and raise additional capital to use for our pivotal trial and some early team expansion and product development to ultimately get us within range of commercialization.
And so what does success look like for you as you think about, your first time at a very young age being CEO and founder of a MedTech company? Where are you hoping to get this to?
Yeah, so my team and I have been very clear with one another and with ourselves from the very start that the reason that we're doing this is to have impact, to improve the quality of life, to improve the standard of care for these millions of tremor patients. And so that is our North Star in every decision that we make is this going to help us get product into the hands of patients faster, or will this help us get product into the hands of more patients? And going forward, those are the two metrics upon which we'll evaluate every decision and upon which we'll evaluate success. Are we helping patients as fast as possible and in as large a number as possible? And ultimately that may end up requiring partnership for commercialization or bringing in professional management that has more experience with some phases of some of the subsequent phases of development and commercialization, or just continuing to learn and grow ourselves to be able to execute those functions. If it looks like that is the most productive and fastest way to producing impact.
Any last thoughts, Daniel? Anything you need from this distinguished audience, or anything that you have learned that you would care to impart as shared wisdom to others who are about to embark on similar entrepreneurial journeys?
There's if anyone has a particular interest in Parkinson's disease or essential tremor, or has loved ones that are affected, we would love to connect and maybe even recruit folks into some of our trials. And like I said, we're always looking for really smart and capable people to help us navigate our first time through the MedTech industry.
Well, thank you, Lindsay and Daniel, for a truly illuminating conversation. I think what you've accomplished already is just incredible. And just a reminder that innovation happens everywhere. In this case, it happened in an MIT classroom and has changed the lives of you and your colleagues, but more importantly, changed the lives of patients who are hoping to see innovation in this space. And Lindsay, I have no doubt we'll have you back. Your podcast hosting skills are excellent. So thank you so much for doing this. Thanks as always to folks listening to Making Medicine. Please keep listening and sharing feedback. More from Incubate is available at www.incubatecoalition.org. A special thanks as always to Ashlyn Roberts and Olivia Lucani in the making of today's podcast. And do exactly what Daniel's done. Keep innovating.